How to understand high-grade prostatic intraepithelial neoplasia, HGPIN. Understanding high-grade prostatic intraepithelial neoplasia, or HGPIN, is crucial for anyone navigating prostate health. HGPIN is a condition found in prostate tissue that is considered a precursor or precancerous lesion to prostate cancer. It indicates abnormal cellular changes within the prostate ducts and small glandular structures called acini. These changes resemble cancer cells but have not yet invaded surrounding tissue. First, let's clarify what HGPIN means. It shows cellular proliferation with abnormal features confined inside the existing prostate ducts and glands. This condition is widely recognized as the most likely precursor to prostate adenocarcinoma, meaning it may develop into invasive prostate cancer over time if left unchecked. Now, how is HGPIN detected? It cannot be identified through blood tests like prostate-specific antigen or imaging techniques such as transrectal ultrasound. The only definitive way to diagnose HGPIN is through a prostate biopsy. During this procedure, small tissue samples are taken and examined microscopically by a pathologist. When looking at HGPIN under a microscope, pathologists identify specific patterns, such as tufting or micropapillary formations. These patterns help distinguish HGPIN from actual cancer. Immunohistochemical staining techniques are also used to differentiate HGPIN from invasive cancer by identifying specific cellular markers. What does the presence of HGPIN mean for a patient? If HGPIN is found, especially in isolated biopsy cores, it indicates an increased risk of developing prostate cancer in the future, often within 5 to 10 years. If multiple biopsy cores show HGPIN, the risk of finding invasive cancer on subsequent biopsies may be higher, although this is less predictive with modern extended biopsy techniques. Currently, there is no standard treatment for HGPIN itself. Patients diagnosed with HGPIN are usually monitored closely with regular prostate biopsies over time to detect any progression to cancer early. Some therapies, like androgen deprivation or radiation, may reduce HGPIN, but these are not standard treatments for HGPIN alone. Experimental treatments are under study but are not yet established. If prostate cancer is diagnosed on biopsy and HGPIN is also present, the HGPIN does not affect the cancer's aggressiveness or treatment plan. The term high-grade in HGPIN refers only to the lesion's cellular changes, not to the cancer grade or prognosis. In a biopsy pathology report, finding HGPIN means that abnormal precancerous changes were found. It is essential to distinguish HGPIN from actual prostate cancer and from benign conditions like inflammation or atrophy, which may also appear in biopsy reports. The presence of HGPIN warrants close follow-up but is not itself a cancer diagnosis. In summary, HGPIN is a microscopic finding in prostate biopsy tissue that signals an increased risk for prostate cancer development. It is not cancer itself but is considered a warning sign that justifies careful monitoring. Understanding HGPIN helps patients and clinicians interpret biopsy results accurately and plan appropriate follow-up within the context of prostate cancer screening and diagnosis. Always consult healthcare professionals for personalized advice and management.